Hello and welcome everybody to episode 2 of AMHIE on Air. So we'll be talking about a little bit of an end of year roundup, talking about what's happened with mental health and education through the year. So first of all, welcome to everybody and thanks for being here. Merry Christmas. And we're just going to go around and have a little short introduction. So just give us your name and a little bit about yourselves as a little introduction, and then we'll get started. So Helen, did you want to start us off?
Hi there. I'm Helen Pechey. I'm assistant head teacher and designated safeguarding lead, mental health lead, and senior mental. What am I? A mental health first aider. Apologies, I'll have to edit there. At Inscape House School, which is a non-maintained, highly specialist provision for young people with autism in South Manchester.
Thanks, Helen. That's great. And let's go on to Symon. So if you introduce yourself, Symon.
Hello, I'm Symon Dewsbury and I'm currently the head of Cromwell High Sixth Form, based here in Tameside, not far from Manchester. I've been involved in special needs education as an educator for 20 plus years, and I've been involved in supporting young people with mental health issues for almost 28 years now.
Okay, thanks, Symon. And let's move on and speak to Rose. If you'd like to give us a little short intro there, Rose.
Hi, so I'm Rose and I work 3 days at Fitzwarren School in Wantage, which is a special school. So I lead the interventions there, and outside of that, I write content for health and education, and for publications really on mental health, sharing kind of strategies from SEN with mainstream schools.
Okay, perfect. And last but not least, Ian, if you'd like to give us a short introduction.
Yes, hello, I'm Ian Jefferis. I'm a coach. My background is actually totally different from education. 25 years in the Royal Navy, running a couple of small businesses in a town called Weymouth on the sunny south coast. I specialise as a coach, coaching teenagers and also possibly young children, and I'm involved in the development of training for coaches to continue that sort of work.
Fantastic. Thanks very much, Ian. Okay, so let's start off with a little bit of a question, a little bit of an open question. Looking back at the past academic year, what would you identify, guys, as the most significant mental health challenge that you think that your students and the people in your setting or your experience have faced? So let's start with Helen.
For me, and again, it's interesting to hear what different areas have. It's access to external support and external services. For a variety of reasons, is having a huge impact, because even if we can get a referral through with CAMHS and get some input, very often because of the needs of our students and because we have some counsellors within school, the bounce back is, I think it's best dealt with in school. When we're making those referrals, it's because we've gone as far as we can within school. And I think that's just putting a huge strain on staff, being able to support those young people. We have lots of children with, maybe got quite a long education history and have traumas relating to school, maybe EBSNA. And the longer that they're not getting the intervention, the longer that they're out of school or not accessing school fully, and it can have a hugely detrimental impact. That's what I'm finding is actually being able to access that support as quick as I can.
Wonderful, thanks, Helen. So Ian, what do you think about what Helen was talking about, accessing support there? Was that something that you'd agree with in your line of work?
I would fully agree with it. I'm a volunteer for Dorset Mind, which is part of the Mind group, and I'm hearing this again and again and again, that the waiting aspect is very difficult, because CAMHS effectively tends, this is my view, works as on counsellors, and Helen mentioned counselling specifically. To me, there is a a bit in the middle here, where life skills can be generally developed through coaching techniques. Now, coaching techniques are available to almost anybody, but some people are actually accredited coaches. Anybody can be a coach. In fact, anybody can be a counsellor as well, but that's beside the point. But teachers are not necessarily trained in that line. And there are some tremendously good teachers who take this holistically, and indeed they work really, really hard to get involved and to bring on their wards as much as they can. But there is this big gap. There is not enough people there to diagnose, to take forward. The big question then is whether a diagnosis is actually really required, or whether there is an area where people are almost encouraging to get a diagnosis in order to develop more support. I may be being a little cynical here. Remember, I'm on the outside looking in.
So Rose, would you agree with what Ian's saying? Do you think that sometimes people will push for a diagnosis when it's not required?
I think, so my thought, I agree with Helen. I think that that it's really tricky. There's a real challenge with students getting the support that they need. And I think particularly in mainstream settings, we've got so many incredible teachers, but I think there's definitely a sense that teachers don't feel kind of equipped, or that they've had the training or kind of tools given them to support children, like that, you know, our growing number of children who communicate or regulate or process differently. So I kind of think in terms of big mental health challenges, I think for teachers it's that not having those supports, but also that then the impact of that on our children with SEN needs, because if the teachers don't have those kind of fundamental strategies in place, then the world isn't then, or the classroom, it's not being set up for our children with autism, our children with SEN needs. We really need to be creating really predictable and safe environments for them, and actually our classrooms can look quite different, or the support that students can receive from school to school can look quite different.
So Symon, I know that you mentioned you were in a specialist setting, but in your experience with mainstream, do you think that these two things are true? Do you think it's quite different in the classroom?
Yes, definitely. And going back to Helen's point, accessing external support is exceptionally challenging. And depending on the quality of clinician that you're working with, they don't always have the SEN tools to be able to engage with their SEN clients. So things like augmented communication, the use of PECs, classic Jungian approaches based on talk therapies don't resonate wonderfully with some of our kids. However, by using small world play and other approaches, we can tap into and support our young people. And I think that can be a real issue, can't it, Helen? Getting the right person to access to reach our young people. And in mainstream, definitely, the provision and skill set is very different.
Yeah, I'd agree, Symon. And I think all our young people are on the autism spectrum, and they range from students who have no verbal communication, and a very high level of support need, like Symon was saying, up to students who go and do A-levels and go on to university, but don't have the social communication skills to be able to survive, for want of a better word, in a mainstream setting. And there is very, very little provision for those young people, because they don't necessarily fit the profile of core CAMS, but they also don't fit the profile of LD CAMS. So very often they bounce between the two and actually still don't get the support that they need, because they are verbal and able, if you like, academically, that the level of their need is invisible to professionals. And I don't think it's through the want of trying. It's not the professionals' fault. You know, they have a very limited amount of time to be able to support, but there is a huge gap. And, you know, the statistics are there for young people who are neurodivergent, with the statistics around mental health, suicide, self-harm is, I think it's 4 times more prominent than the main population, the neurotypical population. So there's clearly a huge gap in provision for those young people.
Yeah, it sounds like when I've been looking at a lot of the statistics coming through sort of our end and what's being published, you know, that's why this new kind of policy is going to be coming into place in the new year. So as we've sort of gotten onto the topic a little bit, what would be your view on what's coming up with this new white paper, Helen? Do you think that this is going to help solve some of these issues? Big question.
Next question. In answer,
Yeah.
no, I don't. Yeah. I think the white paper in general completely misses the mark. Yeah, I don't think it will. I think the whole system needs to go right back to grassroots. And I don't know how you do that. It's the same with the social care system, and everything needs to be stripped right back and started again. But the horse has bolted, so I don't know how we then close the stable doors. I think a lot of it is around, obviously, a huge amount of investment needs to be made. Where that money comes from, I don't know, but a lot of it is around education for existing mental health staff, for even existing medical staff, other services such as police, because it very much depends on who you see and their understanding, particularly around neurodivergence, as to what kind of support you get. And I think that there's a huge like disparity between, you know, depending on your local authority and depending on who you see within that local authority, what kind of provision you get.
So Rose, what's your experience with it in your area, your provision?
Yeah, so I think similar, you know, it is really tricky that referrals to CAMHS in particular take a really long time. My thoughts are kind of on like looking forward though, on kind of the new curriculum, or you know, what's happening moving forward. I think there is a real focus on kind of inclusion and accessibility, and I think what I really hope to see is things like kind of understanding emotions and feelings, that kind of being seen as the prerequisite to learning. So I think I'm hoping that there will be lots more on visual timetables, for example, not being seen as an extra support, but something that is required for learning, like the use of now and next boards, the use of language, aided language boards, not just for communication. I mean, communication is huge, but not just for communication, but for well-being in general. So I think, yeah, there definitely is an issue with provision. I also think that there's so much we can do to make our environments safer and more predictable for the students that we have. So I think there's kind of a foundational foundation that we can kind of roll out to mainstream and you know, to really give our children with SEN needs that you know, the tools that they need, or the teachers that support our children to have the tools that they need to make those safe environments.
Simon, what sort of tools would you like to see coming through? What offer would you like to see?
Well, going back to what Rose was saying, we've got some very good evidence-based approaches in the SEN world, haven't we? So we talk about structure. So we look at Teach, a wonderful way of making the environment explain itself to you without micro transitions. Yeah, we go back to the visual stuff again. That helps to order the world. All these things help anybody, don't they? And they could easily be adopted. And the complexity of language as well for some young people, they've got English as additional language. The tools that we use, like, I'm showing my age now, but words to text programs that And it's so wonderful, isn't it, that you can generate images that relate to words instantly now, yeah, that can help somebody that has got no understanding of English to understand what you're talking about. There are tons of approaches that we can use. And getting back to that safe environment, we talk about mental health, so we're talking about trauma-informed practice. So we make people feel safe and we communicate that with our environments, don't we? And that starts with our staff and the skill of our staff as well, and how they approach the young people.
Okay, Ian, did you have anything else to mention on that subject, what Symon was talking about?
Yeah, I'm feeling very slightly out of my depth here, mainly because I'm looking, as I say, I'm on the outside looking in, and I almost sort of had a question here of saying, look, if we had a completely blank sheet, how would you start again? But to me, schools do a brilliant job in 2 of the 3 areas to progress their students. Yes, it's academically based, which is, and that is the way of schools. Education is academics, unfortunately, which means that there's a number of people who may not be so academically inclined who lose out, because most of the curriculum is about ticking the academic boxes. And the area that I see from the outside looking in is that the third skill, which is missing, is that mental preparedness. So the schools are very good at technique, at getting exams passed and things like that. They're very good at content for what you need to pass the exam, but they lack the abilities, opportunities to support the mental health and the mental condition for students to do their best. I know I'm going outside of SEN now, I'm going much more general, but it would appear to me that if we could start again almost, then this must be a major factor. And because I don't believe teachers are actually taught how to develop that mental support. Tell me if I'm wrong, please. But they're very, very good at the first 2, but they have not got the skills for the third generally, and this makes it very, very tricky. So if we can start developing those life skills at an early age, and we're talking about going right back to reception, perhaps even preschool, to strengthen the students, therefore they are less inclined to develop mental health difficulties, and therefore sort of to mitigate the whole thing. You absolutely, whoever said it was the horses bolted. Yeah, absolutely. So how can we recover the situation? I think we're going to lose an entire generation, but how can we recover the situation going forward?
Yeah, so it's an excellent point, Ian. And I think that moving on to sort of talking a little bit more about this new curriculum, because I know you mentioned it a little bit earlier, Rose, as well. There is talk of those mental health and well-being being part of that curriculum, and what that will look like at the moment we're not 100% sure. So Rose, you were talking a little bit about it earlier, so what would you like to see? What do you think would be a good start, sort of based on what Ian was saying about getting that formative teaching in for mental health and well-being?
Well, I think then what I'm reading, it looks as though like well-being isn't going to be that kind of optional extra anymore. It's really going to be seen as an entitlement for our students. So I think that's a really good starting point. Obviously, my focus is SEN, so I think it's really I get asked a lot about emotional regulation, and actually, it's people are really interested in what you can do when someone is dysregulated, but I think we need to be going back and looking at what we can do to ensure that children don't become dysregulated in the first place. So I know I keep saying it, but what can we do to make sure our children feel safe and secure? So I think it's about those strategies like really knowing our pupils, knowing what their strengths are, knowing what their difficulties are, using those strengths to kind of support them through those difficulties. I think communication and just building relationships, having that connection is so fundamental to everything we do as teachers. And then I think you can build on that with some really core strategies in terms of, again, sorry, I'm talking primarily about SEN because that's my knowledge. But just I think for teachers, it's especially in mainstream schools, it's so overwhelming. There's so many different resources or things that you could look at, and you're not really sure where to start. But actually, there's some key things that we just need to get really good at that will make such an impact on for our children, for our learners with SEN, and those strategies that we look at kind of for these learners really marry up with trauma-informed practice. So there's so many crossovers between the two, and so actually when we are implementing good practice for SEN, it actually supports all our learners, and particularly those that are vulnerable, you know, have trauma issues, maybe are in care or are carers themselves. And I think it's just it can be really simple things. It's like giving our students enough processing time, enough time to react. It's about reducing our language, you know, really reducing that kind of cognitive overwhelm. I talk about visual timetables a lot, I know, but I see that they are often in mainstream schools, but it's that understanding of how to use them. Actually, it's really significant for children to be looking at them and referring to them for each activity and having a clear marker for when a lesson has finished. Now, next boards I think are so powerful, but it's also so key to have that, and I mentioned earlier, just to have that way for our children to communicate as well. So there's lots of children that struggle with that kind of verbal communication, and they really need those packages so that they have ways to express themselves and to make sure that they can get across their wants and their needs.
Symon, you know, in your experience, do you agree with Rose? Do you think that that's going to be sort of the key to establishing, you know, this foundation that the new curriculum is discussing with mental health, or was there other thoughts you had?
It's a tricky one, and again, I've been in SEN land for a very long time, and 10 years ago, sensory processing wasn't registered. Yeah, we lent very heavily on teaching the Mazibos stuff, very, very heavily. But now sensory processing is huge. We talk about visual timetables now and next. We talk about the issues of artistic inertia, moving between activities. Then we look at sensory processing, and for any young person, anyone who's got anybody, right, we've got 8 senses, okay, and these can have a huge impact on how we filter the world, can engage with the world, and getting back to that feeling safe and having those tools employed. We've got lots of young people now. If you walk around supermarkets with the big headphones, because of the effects of auditory stimuli, yeah, and it helps to filter out noise cancelling headphones that are wonderful, that limit those sounds that can be so distracting. Yeah. So yeah, I think there's a huge amount that mainstream can adopt from SEN land. I also think now we know more now that the neurology of behaviour need is becoming more prevalent. We need to lean on this new research, don't we? Very heavily. And I think in terms of mental health, we're at that crossroads now where mental health has always been psychology, but it's now starting to become neurology as well. And as we draw on things, I think we're going to get the best practice we can, as long as we move with the most up-to-date research.
Yeah, because there's been a lot coming out, sort of coming through in the last few months, at least, hasn't there? You know, big research projects, big reports that are coming in, you know, and talking to children in schools and getting that feedback, and that's been, I think, quite formative in what people have been discussing in terms of what they want to see going forward. Would you agree, Ian? Like, have you seen much of what's been coming through recently in terms of the research surrounding mental health and education?
No, I haven't. It's the answer is a straightforward answer to that. I'm listening and learning as we go forward. You know, I know we're concentrating very much on SEN and things like that, but you know, and I have teenagers of my own, so, or at least I still have one. The other one became 20 about a month or so ago. But it's the but what I'm seeing is that sort of, children are working so flat out, they don't actually have time for themselves. They don't learn perhaps to relax. They don't learn to take time out. They don't learn that they're allowed to take time out. It's go, 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 go. And perhaps one of the ways of doing this is to identify and encourage them to say, you are allowed some time out. You can call it me time. You can call it ESME time. You can call it whatever you like. But that is your time. Give it a name. And even if it's only 20 minutes of just staring out of the window, that's hugely beneficial, provided you don't feel guilty of having done it afterwards. And you don't feel guilty if you've actually identified it as a time when you can do that. You can do what you like. So perhaps there's a chance to sort of to relax, to offload, is a very, very valuable time. I know kids are just sort of dashing around in ever-decreasing circles, whether it be within the classroom or even outside the classroom. But it's sometimes, I think, you know, a time to just sort of teach them to stop and reflect. And if this is done early enough and it becomes a habit, then they will be much more ready to accept what is going on.
Yeah, definitely. Yeah, so let's flip excuse me. Let's flip things on its head a little bit. So we've talked a lot about students and looking at the curriculum and mental health. Let's talk a little bit about staff wellbeing. So let's talk a little bit about the staff that are supporting students in school. So we've just had the teacher wellbeing survey come out from Education Support. It's showing that staff mental health has diminished in the last 12 months. What we would be looking at, or what we're hoping we can do is you know, look at ways that we can support staff wellbeing so that they can in turn support students with their own mental health and wellbeing. So what would you suggest would be a way of you know, looking at better support for staff, you know, not just in the classroom but throughout a school setting in the new year, Rose?
So I think that there are some really good things in place, but I think Helen was talking earlier about kind of, you know, you're kind of picking up different roles, and I think clearer boundaries would be really helpful around the teaching role, because I feel like it's kind of ever expanding. So I think really clear boundaries and systems about what the role of a teacher kind of looks like would be really helpful. And again, when you're thinking about kind of the changing cohorts and things moving forward, I think it's about just ensuring staff will have access to that really good training and knowledge so that they feel prepared to support the children that are in their care.
Yeah, definitely. Symon, would you agree? Was there anything else that you'd build upon what Rose said there?
I would definitely say clarity of role. Ian alluded to it before about how we're trained. My profession is teacher. When I was at university, mental health was just coming in. Yeah, and that is my profession. I'm an educator. But what we're trying to do isn't, we're not just educating young people anymore. We're trying to prepare them for the real world, and the curriculum does not reflect that. There is no emotional mental health curriculum, is there? But yet we're expected to help young people manage the onslaught that is the wider world. Ian was talking about taking time, and this sounds very much like the work of Paul McGee, who wrote the Symon books, which are wonderful for teaching resilience and mental health for young people. And this idea of taking time, when you look at a school day, especially with our mainstream counterparts, and I'm lucky to have friends who are still in mainstream, the minute those young people come in, it's lesson. I've got a beautiful 13-year-old daughter, and she will literally walk through the door. It's lesson. Very, very short lunch. less and less an after school club, homework. So where is this opportunity to decompress mentally? Yeah. So the curriculum is very tight. I know they're looking at reducing options to reduce some of the stress, especially at GCSEs. However, it is a very, very high pressure time for a lot of young people. I know my daughter's about to take her options and she's really quite concerned it's the right thing. So it's a lot, isn't it?
Yeah, it is a lot. You know, and like you're saying, they are expecting this delivery from teachers in the classroom, expecting this delivery from school staff of, you know, helping students and pupils with their mental health, but there's no structure for it. There's no provision. So Ian, what do you think could help with staff being, you know, staff wellbeing in schools going forward for the new year?
Oh, I could throw a big bomb into this one, couldn't I?
Go on,
You
then.
could.
Yeah, I'm going to.
It's
I'm
Christmas.
going to. I think we have got to really look at the curriculum, the academic curriculum, and we've got to detune it. We've got to be able to prepare people for how to run their lives, how to run the world. These next generations are coming up. You know, we've got to prepare them to be able to take charge, to be able to make decisions, to be able to run their lives. Is the current curriculum actually doing that? I'm going to take an example of mathematics, and for mathematicians listening, forgive me, but why do we still teach trigonometry? What use is trigonometry to the majority of people at school? Of course, when we were making maps in many years ago, trigonometry was all the rage. It had to be, because that's actually how we made maps. And trigonometry is still used in engineering and things like that. But how many people actually go into engineering? That's for example. Surely our curriculum should be about much more practical things, about how to cope with the arithmetic, how to work that way. Language, perhaps English should be, you know, I'm going to get a shot for this one. Perhaps English should be called communication, or any mainstream language throughout the world, because it is about communication. But you know, we perhaps see it as the written word. Perhaps it's now more than that. And you know, by opening it up to what the world is today rather than what the world was X years ago. And there are some things that probably haven't changed since I was at school, and I left school over 50 years ago. So to me, it's about detuning the academics and bringing in the E of education, getting people ready to cope with what is actually quite a challenging life for our next generations coming up. You know, they're going to have to run with this. Us parents, us grandparents, probably haven't got a clue. But we've got to prepare these guys to make their own decisions and to run with what they've got.
Yeah, you know, I think life skills is something at the moment that I've heard. I mean, personally, I haven't had this experience, but I've heard from you know, some of our members that life skills is something that teachers are expected to teach. So a lot of children are coming into education and they don't have, you know, life skills such as knowing how to deliver personal hygiene, for example. You know, they don't have that. Some of them are coming in and they haven't been properly potty trained, so they're still in nappies. You know, and you know, the impact then is that, you know, staff at schools are then expected to not only, you know, be teachers and mentors and you know, mental health supporters, but also to train people with life skills. Well, where's the support for the staff? You know, and that's what we're talking about. You know, that needs to be more fundamental. You know, having that you know, foundation, so that, you know, that there is that clarity, and that's what Rose was talking about, understanding, you know, what's expected. So let's put it into a question. So Symon, I'll go with you first this time. If you could choose one singular mental health priority for education in the new year, to build upon a change, a new intervention, a strategy, training, what do you think would would be the biggest thing? What would you think would have the best impact?
For staff or for young people, which one?
Well, overall, maybe do one of each if you feel that you want to, or or an overarching, principle, something that you feel would make a difference.
That's a huge question. I think when we talk about mental health, everyone's got mental health, yeah, and some days it's in a great shape, and other days it's not so good. I think it's very different for different settings. So in an SEN provision, that would go back to teaching those core regulation skills so we can stay regulated. If we're looking at our mainstream schools, that would be teaching those foundational skills like Ian's been talking about and giving the kids the tools. The Association of Colleges have released some research from last year saying about a lot of their higher academic students are struggling to time manage, and the pressure that that's causing them with all the pressure of writing dissertations, A-levels. So teaching those people how to decompress and take that time. So I think it's a very big question, that one, Lily.
It is a bit of a big question. Sorry, go on.
So I think it's you would have to match the priority to the relevant areas of the curriculum, especially because we've got age development and we've got phase development. So for tiny people in nurseries, we're teaching the ability to regulate and co-regulate. But as we get older into our universities, and if we look at some of the research again from the Association of Colleges, students at university, they're suffering greatly with things like loneliness, depression's on the rise. Okay. And again, this comes from that pressure, that academic pressure. You've got one chance to do this, potentially going to be £40,000 in debt at the end of your course. It's a huge amount of pressure, isn't it? But those needs are very different across services. And I think that's the way we've got to look at it. We match those priority needs to the right stages that people are in. What do you think, Rose?
Well, yeah, no, I agree, definitely. I think people are so unique and what everyone needs is very different. I think I saw a really interesting quote actually by Pookie Knightsmith, Dr. Pookie Knightsmith, and it was saying that asking a dysregulated child to make better choices is like asking someone who's drowning to swim more efficiently. And I just thought that was such a brilliant quote. And so my kind of thinking around that is that I agree with you about all the emotional regulation work. I think that's really important. And what's fascinated me recently is learning lots more about interoception. And so we, some of our children really struggle to kind of piece together like how they're feeling. And I think this ties in with Ian's thoughts as well on like in my school, a big focus for the next year is kind of really embedding interoception and really supporting children with getting back inside their bodies and noticing how their body feels, and not necessarily having at this stage to add that emotion, like, to define the emotion that they're feeling. But it might be that you see someone's frustrated and their face is red. So we might be saying to them, oh, do you need an ice pack or some time outside? But looking kind of at what's going on with these children, helping them to support what's going on in their bodies, and then looking at that next strategic piece. So I think the work by Kelly Marler is absolutely fascinating. And I think for going back to your question, Lily, about like what one thing I think for me, that there were, like Simon says, there's hundreds of things, but I think for me, like moving forward in January, that's something where I'm going to be focusing lots of my attention.
And no, that's great. And Ian, what would your thoughts be? Was there be anything that you think could support mental health and education in the new year? A change that we could make, a training?
Yeah, somebody said it to me the other day, and it rang true, that some people don't realize that to feel not on top form is actually perfectly natural. It's almost as if we expect to feel 100% every day. Yet, in order to be average, we've got to expect less than 50% sometimes. We've got to be able to cope with that as well. It's natural. It's what life is about. It's about ups and downs, and trying to, for a lot of children, trying to realize that they're not going to feel 100% all the time. You know, as adults, we don't feel 100% all the time. So why do we expect our children to be ticking box 5 all the time? You know, if they're only ticking box 3, is that not enough? And just to accept, if children can accept that, you know, that they may not be feeling on top form, but if they're not feeling on top form, other people may not be feeling on top form either. So it's a case of understanding that just because you feel great, not everybody else does. And being aware of that and learning to work socially with others, and just having that emotional understanding that, you know, people may or may not react as you expect them to, but that's normal, that's life. As for teachers, quite honestly, the more time they can take off, the better. They need it. I think if I could wave a magic wand, perhaps I can get rid of all those boxes you have to tick. Wouldn't that be lovely?
No boxes at all. Yeah, I mean, sometimes boxes are good, but I understand what you're saying. Yeah, you know, lots of boxes can be overwhelming for sure. All right,
unfortunately, they focus the mind in a particular direction, don't they?
They do, that's right. Yeah. You know, and keeping things more dynamic, and you know, talking about individual settings, individual people, and treating people not as one big group who can all be fixed by one solution, as Symon said, and actually saying, you know, individually we need to look at what we're providing, what mental health looks like on an individual basis. I think that's the way that we move forward in the new year. Stop expecting everybody to fit into one, you know, small area, your boxes, Ian, and expect that, you know, people are individual, and they, you know, they cover many different facets. And I think, you know, that's true not only in education, but, you know, as a race, I suppose, as a society. Should I say?
It's a life skill.
It is absolutely a life skill. Okay, well, I think we'll end on that quite broad note. So thank you very much, everyone, for being involved in AMHIE on Air episode 2. Thanks very much for Helen. We're sorry she couldn't come back, but I'm just going to say thank you to her because she's not here. Thank you to Symon, Rose, and Ian, and Happy New Year and Merry Christmas to you all.
Merry Christmas.
Oh, Merry Christmas. Thank you.